Stop scrolling if you are preparing for physiotherapy exam. Here, I'll be solving important physiotherapy MCQs along with detailed reasoning to help you prepare better for your exam. Yes, for the next part, I am solving here 11th to 20 MCQs from the GPSC held in 2025 for physiotherapists. 11th is, which one of the following is a correct statement for infant respiratory system? Option A, vertical ribs. B, horizontal ribs. C, elliptical shaped diaphragm. D, thorax sloped downward. Here A is vertical ribs. It is not seen in infants. Vertical ribs are seen in adults. Option B, horizontal ribs. Yes, horizontal ribs is present in infants. C, elliptical shaped diaphragm, that is not present in infants. Infants' chest is flatter and less efficient. D, thorax sloped downward, that is not seen in infants. Infants' thorax is more circular or barrel shaped but not sloped. So here option B, horizontal ribs, is the right answer. 12th, choose the correct statement for plyometric training. Option A, plyometric training involves slow velocity concentric to eccentric muscle loading. Option B, plyometric training involves high velocity concentric to eccentric muscle loading. Option C, plyometric training involves slow velocity eccentric to concentric muscle loading. Option D, plyometric training involves high velocity eccentric to concentric muscle loading. Here the correct answer is D, as plyometric training uses the stretch shortening cycle, that is rapid eccentric contraction of muscle, that is muscle lengthening, and that immediately followed by concentric contraction, that is muscle shortening. For example, jump training. Here landing in the jump, that is eccentric quadricep contraction, and followed by immediate jump, that is concentric quadricep contraction. Here the purpose of plyometric training is to improve power and to improve neuromuscular efficiency. That is why option D, plyometric training involves high velocity eccentric to concentric muscle loading, is the right answer. 13th, in this question two statements are given, one labeled as assertion, that is A, and the other labeled as reason, that is R. Read the statements carefully and choose the correct alternative A, B, C and D as given below. First, assertion A, that is height loss is not an indicator for the presence of vertebral fractures. Reason, women can lose up to 1.5 inch or 3.8 cm of height as part of the normal aging process. Option A, both A and R are true and R is the correct explanation for the assertion. And B, both A and R are true but R is not the correct explanation of the assertion. Option C, A is true but R is false. And option D, A is false but R is true. Let's see. Here assertion is that height loss is not an indicator, but yes, if height loss is there in case of vertebral fracture, it is a clinical indicator. Height loss is a clinical indicator for vertebral fracture. So assertion A is false. And the reason, women can lose up to 1.5 inches or 3.8 centimeter with normal aging. Yes, that reason is true. As normal aging includes disc degeneration, postural kyphosis and vertebral compression that can lead to loss in height in women. So here the right answer is option D, A is false but R is true. 14th, LSVT big program focuses on motor skill improvement in which group of patients? Option A, patients suffering from cerebellar ataxia. Option B, patients suffering from Parkinson's disease. Option C, patients suffering from spinal cord injury. Option D, patients suffering from cerebral palsy. Here LSVT, that means Lee Silverman voice treatment, that is big program, is intensive therapeutic exercise program for people with Parkinson's disease. So yes, option B, patients suffering from Parkinson's disease, is the right answer. 15th, measurement of percentage of hemoglobin saturated with oxygen is called option A, FiO2, option B, PaO2, option C, SaO2, option D, SpO2. Let's see. Option A, FiO2, that means fraction of oxygen. Option B, PaO2, that means partial pressure of oxygen in arterial blood. Option C, SaO2 means arterial oxygen saturation. Option D, SpO2 means peripheral oxygen saturation. As the question asked about the percentage of hemoglobin saturation, so option C and D both suggest the saturation of oxygen within the blood. So option C and D both can be the right answer here. 16th, On examination, Mr. X is able to generate force against the resistance of physiotherapist, but pain increases with an increase in resistance of the therapist. What is the correct interpretation of the examination? Option A, gross lesion, probably a fracture or metastatic lesion. Option B, injury to some part of the muscle or tendon. Option C, either full rupture of muscle or interruption of nervous innervation to the muscle. Option D, normal musculotendinous structure. Here in the question, it is mentioned that pain increases with the resistance. So any contractile tissue structure is injured here. That can be a muscle strain, tendinitis or any partial tear. So yes, option B, injury to some muscle or tendon is the right answer. 17. Absolute refractory period for the skeletal muscle is option A, refractory period where the muscle does not respond to the stimulus no matter how strong is the stimulus. Option B, period where muscle does not respond to a stimulus which is only just adequate but does respond to an usual strong stimulus. Option C, both A and B. Option D, none of the above. So yes, there are two types of refractory period. First one is absolute and second one is relative refractory period. Absolute refractory period means muscle cannot respond to any stimulus even if it is strong or very strong. Second, relative refractory period means muscle can respond only to stronger stimulus. So option A suggests absolute refractory period and option B suggests relative refractory period. That is why option A is the right answer. Refractory period where the muscle does not respond to the stimulus no matter how strong is the stimulus. 18th, position of maximum elongation of median nerve includes following components. Option A, shoulder abduction to 110 degree, elbow extension, shoulder internal rotation, supination of the forearm, wrist, finger and thumb extension, and finally contralateral cervical side flexion. Option B, shoulder abduction to 110 degree, elbow extension, shoulder extension, rotation and pronation of forearm, wrist, finger and thumb extension, and finally contralateral cervical side flexion. Option C, shoulder abduction to 110 degree, elbow extension, shoulder external rotation, supination of forearm, wrist, finger and thumb extension, and finally contralateral cervical side flexion. Option D, shoulder abduction to 110 degree, elbow extension, shoulder external rotation and supination of forearm, wrist, finger and thumb flexion, finally contralateral cervical side flexion. Here, position of maximum elongation of median nerve, that is ULDT 1, we can say upper limb tension test 1. So the upper limb tension test 1 sequence is matching to the option C, shoulder abduction 110 degree, elbow extension, shoulder external rotation and supination of the forearm, wrist, finger and thumb extension, and finally contralateral cervical side flexion. So yes, here option C is the right answer. Let's see why other options are wrong. In option A, they mentioned shoulder internal rotation, that is wrong. Shoulder external rotation is there in ULTT 1. In option B, pronation of forearm is mentioned. Yes, that is wrong. Supination of the forearm is present in ULTT 1. And in option D, wrist, finger and thumb flexion is mentioned, but in ULTT 1, that is wrist, finger and thumb extension. That is why option C is the right and other are wrong. 19th, in this question, two statements are given, one labeled as assertion and other labeled as reason. Read the statements carefully and choose the correct alternative A, B, C and D as given below. Assertion, knowledge of the ossification centers and their location in pediatric population is important. Reason, this growth center may be vulnerable to injury until fused. In assertion, they mentioned knowledge of the ossification center is important. Yes, because growth plates are the weaker than the ligament. So, that is why assertion is right, but reason, growth center is vulnerable to injury. That is true. Yes, injuries often affect epiphyses rather than the ligaments. So here the option A is the right answer. Both A and R are true and R is correct explanation of the assertion. 20th, Chopard disarticulation is option A, complete tarsal amputation, option B, partial tarsal amputation, option C, complete metatarsal amputation, option D, partial metatarsal amputation. Let's first see what is Chopard joint. Chopard joint is mid-tarsal joint, that is in between the talus and navicular and calcaneus and cuboid bone. In Chopard amputation, the forefoot is removed but the talus and calcaneus remains, so it is partial tarsal amputation. So option B, partial tarsal amputation is the correct answer. Like, share and subscribe if you found this video useful. Don't live in between. Go for the next video. I am mentioning 21 to 30 MCQs there.